Hello?
Vinny?
Yes.
Hi, it's Dr. Townsend. How are you?
I'm good. How are you?
I am good. You have a few moments for me?
Yeah.
Cool.
Sorry. I
No
just
worries.
woke up and I'm a little baffled because my alarm didn't go off. Okay.
I'm just typing. Just remember, when I'm quiet, it just means I'm typing.
Oh, okay. Why did my alarm not go off?
So, how are you feeling?
Well, I feel alright, I guess, considering. Um,
Considering what?
just considering all the shit I'm going through right
Okay.
now. These meds are pretty alright, I guess, but, the only issues I have with them is they make me really sleepy, and they give me body aches when I wake up, and they make me gain weight.
Okay.
Cause I'm back to 300 again already.
What were you down to?
I was down to like 210, so I've gained 100 pounds within a month. Well, pretty much within 2 weeks of these pills, cause I didn't have any more after I got out of that hospital. So within a week, I gained about 50, 60 pounds. And then I'm back on them again, and I'm already at 300.
Okay, we're gonna have to talk about that then.
Yeah, because like I have been pre-diabetic off of these
Mm-hmm.
medications and stuff. I'm not sure if it was specifically these pills, but the pills have made me pre-diabetic. In a single year off the medications, I lost 100 pounds and got rid of my diabetes and all that.
So, um, what, um, how was it being in the hospital again?
That was baloney. There was
Yeah.
no reason for that. Even the nurses and doctors were like, "Why are you here again?" I mean, I was just in my apartment. I was maybe on my fourth beer, listening to music, and the cops call my cell phone and tell me to come outside, and they immediately just put me in the back of a police cruiser. Like, this is police harassment, and I'm sick of it. And then I do got that charge from the last hospital, and I guess they're charging me with a DUI as well for marijuana. So I got a court date on the 18th.
Did they issue a ticket?
Yeah, they gave me a ticket for running a red light, reckless driving, and a DUI for marijuana. And they harassed me. The car wreck happened maybe around 10:30 to 11, and there were 12 officers that showed up for a fender bender. I mean, I'm still driving my car. All it has is a scuff on the right front bumper.
Mm-hmm.
And they gave me screening each cop. There was like a dozen cops there, and one by one, each cop put the handcuffs on me, follow my finger, touch your nose, walk a straight line, and then they put the handcuffs back on me, and the next cop takes the handcuffs on me, follow my finger, touch your nose, walk a straight line. All 12 of them. Each of them did this to me. And they said that they were training rookies. And I was like, well, this is ridiculous. I'm on my way to get my cat. All we had to do was exchange information and I would be on my way. And then they took me to the hospital, gave me a CAT scan, and inside the hospital, they're filling out paperwork and still giving me drug screenings.
Mm-hmm.
And then I go to the hospital where all the nurses are asking why I'm here.
Difference of opinion, it seems, huh?
Huh?
It seems like there was a difference of opinion.
With who?
So, when did you get out, Vinny?
Out of which one?
This is the last hospital where you were.
I just got out. I think this is my third day out.
Okay.
And I was in there for 3 days maybe.
And what have you been up to since you got out?
I've just been trying to get all this stuff together. I finally got my internet working. I finally got my phone to work again because I did leave a message on the grievance line saying how I might not be able to use my phone because my charger port on my cell phone was all messed up. But I went and spent $100 getting my cell phone fixed. So now my phone works.
Okay. So, what do you plan on doing with your time now, Vinny? That you're you have your time back again.
I got a lot of stuff to do.
Like what kind of stuff?
Like this ticket thing, and I still got to get all my affairs in order and stuff to just get back to the point where I was. And then after that, I still have to try and find an insurance that I can afford myself so that I'm on my own insurance and not on my mom's. Because pretty much basically I've been trying to get everything in my hands and out of my mom's hands. Because I mean, you guys might not think that my mom has fictitious disorder, and I never thought that she did either. But after Kelly from Community Reach Center told me that, and I started studying fictitious disorder, my mother looks more and more like she has fictitious disorder every day. I mean, she just tries to sabotage everything that I am. Either because the fictitious disorder, or she just wants me to be her little baby still. You know what I mean?
Mm-hmm.
And she said that she did tell her counselor, and her counselor said that was ridiculous, but I see more and more evidence every day about it. She is just constantly trying to sabotage me every chance she gets.
Hmm. Okay. Vinny, what county was that your ticket was issued?
That was in Parker, and then they
So
took me to Aurora Mental Health.
Douglas County. Okay. And do you have a public defender? Do you know?
No, I haven't gotten anything with it yet. I think I get all
Okay.
this stuff on the 18th when I go there. And in Bridge House, they told me it was a call or a phone call court appointment, but I ended up finding out that that was a lie, and that I do have to show up to Castle Rock. And good thing I found that out, because if I was just sitting at my apartment waiting for a phone call, they would have issued a warrant.
Well, I'm glad you called.
Huh?
I'm glad you called and checked that out.
Yeah, I called him to tell him that my phone wasn't working and I might not be able to do the phone call, and they said, "No, you got to show up." And I said, "Oh, okay."
Oh, good on you then. All right. So that's Douglas County Courthouse, yeah, which is in Castle Rock,
Yeah,
right?
they said I got to go to Castle Rock.
All right. Let's see this real quick here. Okay.
And then I was told by NAMI to ask you why I'm on a certification.
Yes, you are.
Why?
They placed you, I think you were at MCA, and they asked me if I would accept it, if All Health would accept it, and I said yes.
But why am I on a certification?
For something known as grave disability. Do you not have the paperwork?
No. I've never gotten any thing on that stuff, but what makes me gravely disabled?
Well, the simple version of grave disability, and in your case, I would agree with it, is that when your mental illness, that mental illness part of somebody is affecting them, that they can't take care of themselves as well as they usually can when it's not affecting them. That's sort of the the bottom line.
Well, how do I challenge this certification?
Easy, and we'll get to that. It's a piece of cake.
Okay.
Let me ask you, is it okay if I just keep going in this order thing?
Yeah, yeah.
Can you tell me, Vinny, which medications they prescribed you or that you were taking either at Bridge House or before Bridge House?
Yeah, at Aurora North, they prescribed me olanzapine. And then
Mm-hmm.
at Bridge House, they gave me more. And I did just run out of medications yesterday, which is weird because I should have a pill for today. So I must have taken 2 pills at one point. But
So when we're done today, can you call our nurse triage line and ask if that is filled for you? So you would just call our regular number that you call, and then ask for the nurse triage line, and they can get that filled for you.
okay.
Okay. So are those medicines, the olanzapine, is that helping you at all, Vinny?
Well, it definitely does take the edge off, but I am not going to become pre-diabetic again. You know what I mean? Like, we're going to have to find something different.
Okay. Ah. So you have an appointment with Dr. Goya on the 29th.
Yeah, I don't want to be with Dr. Benj or Dr. Goya, and I don't want to be with you, Dr. Townsend.
Well, with me, you don't get a choice, buddy.
Why?
But you can change your medication provider one time with All Health.
See,
So
that's the other thing. I talked to NAMI about this, and they said that it is my treatment, it is my recovery, and I do have last say. And this whole, you telling me that I don't have a choice in my own treatment and recovery.
no. Just with the certification piece, you have a choice with the treatment piece, and you have a choice with the med provider piece. And if it came down to it, and you really didn't want to work with me, although you and I have gotten along quite well in the past, I could send it to Dr. DeWeese or Dr. Jarvis. You would have met both of them when you were at Bridge House.
Well, I have been battling this certification for 1.5 years now, and you keep giving me lawyers that play golf with you on the weekends, and I've only talked to the judge maybe 5 minutes, and I don't appreciate how you keep telling me how I don't have any choice.
So I just told you, like, if you really want to, I could send you to a different psychologist, but they would be doing the exact same thing I am. And you and I sort of have an established relationship, and most of the time I think we get along pretty well.
I concur.
Okay. So, there you go. So, I'll slip around here a little bit just so you can, I'll answer your question. Do you know who your mental health attorney is, Finney?
The same one I had at the beginning of all this.
Wayne Lauer. Do you have his number?
Yeah, and he called me when I was in Aurora North, and I told him that I didn't want to work with him, and he hung up on me.
He hung up on you?
Yeah.
Okay. Were you dropping F-bombs?
No, I told him I didn't want to work with him, and he said, okay, well, and then he hung up on me.
All right. So then the thing to do, if you want to do that, is to write a quick, 3-sentence letter to the judge at Douglas County and tell him that you'd like to be assigned a new mental health attorney.
Because I have told him 100 times or more since all this started that I should not be on a certification and that I need his help. And he refuses and laughs at me like you do.
I've never laughed at you.
You have laughed
at
me.
I've never laughed at you. I don't believe in that. I believe in human kindness and dignity. I've never laughed at a client or patient in my life.
I concur.
Okay. All right. Oh, heavens. Having Monday typing fingers on a Wednesday. And I'm not dismissing this at all. The side effects of your medication are weight gain, sleepiness, and body aches.
Yeah, I get body aches when I wake up. I've been working out all night. And that might also be because it might be causing me to have restless leg syndrome or something like that. But I don't know because I'm asleep. So.
And so, can I give you some advice and you're able to say no if you want to?
Okay.
Okay. So, hang on with that again. So I know you're a nice guy. I have absolutely no doubt about that. You've always, for the most part, even when you curse up a blue streak, we end our sessions pretty good and you apologize and that kind of thing. what I will tell you that you should know is that there are some people that, like, when you leave messages and stuff that are threatening, that's worrisome. They experience that as worrisome. And my recommendation would be, if you're really angry, would be just to hold off before you leave messages. You don't have to. I'm just giving you advice, so that other people experience you the way that I do. Other treatment providers in the past, Michael Corby, those sorts of things, those sorts of people. That's just some advice. You don't have to take it.
And I can agree with that. I definitely should not leave messages when I'm angry. But I do
Well,
disagree that I've been threatened.
neither should I, right?
Right,
You
right.
know.
I agree with
So,
that. But I haven't been threatening anybody. All I've been saying is that giving me those injections is just wrong. That's illegal. That's attempted manslaughter to give somebody injections that they're allergic to. And that's all I've been saying on these messages. I've been leaving voice messages with a grievance line because they're the only place I can leave a message. And all the messages I've been saying is how stupid all this is. And the definition of stupid isn't that you did it on accident, but you did it on purpose knowing that it was wrong in the first place. That's what stupid means. And this is stupid.
mm-hmm. Okay. All right. So, Vinny, is there anything right now that All Health Network or myself could be doing to help you, or support you, rather, more than we are right now?
Actually, yeah. I do have a lot of stuff that I need to get done. And I was thinking maybe getting on the ACT team or something again.
Okay, and I'm going to make a referral for you.
Okay. Where is my list? And I did do most of this stuff since I've been out. I don't know where it is. I think my mom took it.
All right.
But pretty much, well, I needed the internet. I got the internet working. I think the only thing that's left is to try and get insurance that I can afford by myself and get everything in my hands and out of my mother's hands.
Mm-hmm. I understand that.
And then after I get everything nailed down and everything's paid monthly at the beginning of the month and everything, I will be self-sustaining and completely in control of my own life. And that's my goal, is to just be completely self-sustaining and not need anything from anybody.
Okay. That's a great goal.
I think so too. And that's what I've been working on this past year and a half. And every time I get another step in completing this goal of being self-sustaining, my mom sabotages it and she knocks it down. Like, for instance, when I got my own cell phone and my own cell phone service, and I got out of my mom's Cricket service, and I got with Q-Link Wireless, and I bought my own phone, she immediately started trying to take my car away. So then I took my first stimulus check, and I bought the car from my mom in cash. And then it took me about half a year, 6 months, just to get the title for my car. that I
Wow.
paid her for. And I gave her $2,000 for a $1,000 blue book value car.
Why'd you do that?
Because I needed a car and I wanted to buy it, and I wanted it to be my car, not her car. I didn't want to buy
So
it from her. I wanted to
is it in
own
your name?
it, you know.
Is it in your name now?
Huh?
Is it in your name now?
Yes, it is in my name now, and I'm on the insurance in my name as well. But now I
Okay.
just got to get the insurance that I pay for it and stuff, you know.
Okay.
And I think that would be the last step, and then, yeah. And then I think that I'll be completely self-reliant. Is self-reliant the right word?
Yes, or self-sufficient, self-reliant.
Okay, yeah. And that would be the last step.
All right. So right now today, Vinny, this is a Wednesday, and I'm just looking at scheduling you for next month. This is a Wednesday at 9 a.m. Is that a good time to normally talk with you?
I prefer around noon, in case like
Noon?
this happens like it did today, and the alarm didn't go off.
Okay, how about Wednesday at noon on July 7th?
July 7th. Let me see.
And we can schedule that, and then if it doesn't work, then we can change it.
July 7th. July 7th.
And would you like that to be
I already have
in
an
person?
appointment with you on July 7th.
Yeah. Would you like to be in person or on the phone?
I prefer these phone things, because then all I
Then
got
I
to do
will
is pick
keep-
up the phone.
I will keep you on the phone. And do you have availability to do Zoom?
I do, now that my internet's back.
So I'll call you beforehand, and maybe we can do Zoom, because you know what? I don't even know what you look like. I've never seen you.
Okay.
Okay? All right. Any more questions for me, my friend?
I think that is all. Thank you.
All right. I'll talk to you in about a month. Okay? You take care.
All right, bye.